Hello, I'm Rocky Chapin, CEO Emeritus of the Benedictine Health System. As we do every year, we have an opening video that marks 1 year to the next, and this is a year of great change for BHS. A CEO who's leaving, a new CEO who's coming in, all against a backdrop of a greatly and dramatically changing society and political structure. All of those create some opportunity, also some challenges for BHS, and we're going to talk a little bit about that. As I look back at the last 4 years, there are some things that come to mind. One is things that worked out, some things that didn't work out. And some things that didn't work out, I think I would start with the grand experiment we called Interlude. This was a case where our post-acute strategy had been developed earlier than many in our sector. And unfortunately, it ended up in, I won't call failure, but in an ending that we wouldn't have anticipated when we transferred our membership in the three-way partnership to Presbyterian Homes. This was also a learning for us in that a three-way partnership managed by three partners for a single brand didn't work. And I think that was one of those significant kinds of things that one couldn't have anticipated. The other is that the accountable care organization idea that was really the basis for creating the Interlude never really congealed, never really came together in the way that we anticipated that it would. The acute care systems haven't invented the accountable care organization yet. And so the reimbursement didn't change. The transitions of care changed some, but not nearly to the extent that we had hoped. And so it was a case where great idea and one that didn't go quite as well as we had hoped. The second is this whole concept of moving from a holding company to an operating company. This is something that you hear a lot of today. And in fact, we called it One BHS. For instance, if you go to the literature, the public literature today, what you'll see is Ascension is one Ascension. Essentia Health up in Duluth here is one Essentia. And it's a way of trying to articulate the fact that there are some things we're going to do the same everywhere because we know that that will improve quality and provide us better outcomes. But that really didn't capture the essence of what we were trying to do with the One BHS, where we too were looking for how do we strengthen the advantages of systemness for all of our members. One of the things that I'm beginning to hear a lot more, and it came up during our quality program training that is conducted by Jerry Reinhardt. And many times she starts actually by asking, what are you hoping to accomplish in attending this conference? And many of the responses are, I'd like to know the BHS way of doing quality, the BHS way of managing care, the BHS way of working with other associates. And so perhaps the One BHS will become the BHS way, but that's for future leadership to conclude. But I think it continues the quest for how can we take advantage of the fact that we are a system, a fairly large system. One of the aspects of our Catholic identity that I think we can all be very proud of is that the Ziegler Group, who does a long-term care review of the 150 largest long-term care organizations in the country. We are on that list, and we are the largest Catholic long-term care provider in the United States as of the end of 2017. And I think that's something that has given us the recognition as well as the responsibility to make sure that the services that we provide are well representative of the Catholic faith and of the Catholic services that are provided by our colleagues across the country. The whole idea of One BHS or the BHS way is still a work in progress. You've seen the work that we've started now in consolidating all of our policies and procedures into one place on eSource, of having a standard format for them. And the goal of that is to make them all more easily accessible so that in the midst of survey, we don't have our colleagues calling one another and saying, do you have a policy for, do you have a policy of? All of that is already online and they know where to get it very quickly. The other thing that I see happening is that we've increased our clinical capacity over the last several years. And clinical capacity in this case means the ability to take care of a broader group of people than we previously were able to. So we have more regional nurse specialists providing support. We've elevated the directors of nurses into a clear leadership role within the organization. All of those things help us respond better to the clinical needs of the people that we serve. Even though BHS is moving toward a greater emphasis on housing and assisted living, I do believe that the quality of care that we provide and the clinical capacity that we have is going to be the moments in which we distinguish ourselves from our competitors. The other thing that didn't quite work out as we had planned is this, what I would call the staffing crisis. It hit us very hard about 3 years ago. And with a ferocity that we just didn't anticipate. In fact, many of our colleagues would talk about it was the worst ever staffing crisis that they've experienced. We've done some things, I think, to address that, and that starts what things have worked out. And one of those is CareForce Innovation, our partnership with St. Catherine University and Presbyterian Homes, working to, again, support the increase in capacity for clinical programs and services, to attract people into the senior care professions. We engaged in a design thinking workshop over a 3-day period with our colleagues from Pres Homes and from the faculty at St. Catherine, and uncovered a lot of things that worked against people working in long-term care, the sense that it was somehow less than other opportunities that young professionals had. And we started to break those down and are looking at some things now that I think are very exciting for BHS as we move forward. One of the exciting parts of that is the Clinical Scholars Program, in which our staff at Benedictine Health Center, Minneapolis, worked with the faculty at St. Catherine University relative to preventing pneumonia in vent-supported patients. What was fascinating there is the findings were good, reproducible. They are part of a article that's being published in a national journal. That is a really exciting thing for BHS. Financially, we have improved tremendously over the last several years. Last year was one of our best years ever. This year we're continuing that. A lot of that has to do with operational efficiencies and the focus we have on making sure that our staffing is aligned clearly with the level of service that's being required by the people we serve, as well as the fact that, and I have to give a little bit of a nod to the Minnesota State Legislature, who came forward with a cost-based reimbursement model for Medicaid, of which is a large percentage of the people that we serve. That has, now we're beginning to see the fruits of that. And so we have higher rates that allowed us to provide a little bit higher salaries and benefits to our associates, and as a result provided us a little bit relief on the staffing crisis that I just had mentioned. The other piece of what has improved in terms of clinical capacity is the work that Dr. Neil Budensiek has done relative to supportive and palliative care. He has really turbocharged that conversation within BHS. Our e-kits, a number of things that we're doing now assure that the people we serve are being served much better and more completely than ever before. And we're engaging in those crucial conversations near the end of life with residents and their families and others so that we have a smooth transition into the next. And I think that is what's so very exciting about this new development. Another area that we have done very well in is what I will call Catholic identity. The Benedictine Health System continues to be recognized as a leader in Catholic healthcare, both by CHA and by others. Our sisters are held out as examples of discernment relative to reserve powers and how they make sure that the mission and the integrity of that mission are carried forward in their ministry. All of those things are well recognized. Our distinguishing characteristics of the Benedictine Catholic Healthcare Identity for Benedictine Health System is in its third printing. When I go to national conferences, I'm often stopped by other colleagues saying, could I have a copy of that? Could you send me a copy of that? Which we're able to do, and I think it adds to our reputation as an organization deeply committed to Catholic identity and Catholic healthcare. And finally, I would like to close with a word of thanks and gratitude. First of all, to the Sisters of St. Scholastica Monastery here in Duluth, Minnesota. They are so committed to the mission and ministry of elderly services and serving the elderly, and they want that to be an enduring ministry as it moves forward, and their support is phenomenal. And they're a group of women that I have only the greatest of respect for as I've watched them discern now the next phase of sponsorship and as we move forward with that. The second group I'd like to give a great deal of thanks and gratitude to are you, the associates of BHS, who make the reality of that mission come true every day in response to the needs of the thousands of people we serve every day. And finally, I'd like to to give a shout out and a thanks of gratitude to our Creator, the Creator of all that isn't seen and unseen, who has given us the gifts of love and grace that allow us to work together for the common good for all of those that we serve and for those serving as well. As I end this phase of my career and enter into a new phase of my life, I also want to acknowledge that BHS is in very good hands. We are in the process of making this transition, and as I pass the flame of BHS to Jerry Carley, our new president, I want you to welcome him with me to the next phase of his life and his ministry going forward. Thank you so much.
Hello. As Rocky mentioned, my name is Jerry Carley, and I'm excited to be visiting with you today and becoming an associate of the Benedictine Health System. BHS has a wonderful reputation, and I'm proud to be a member of the BHS team. First, a little about myself. I'm married to my wife of 23 years, Julie, and I have 2 daughters. Katie is 21 and studying to be a speech-language pathologist at Wichita State University. And Molly is 17 and will be attending St. Benedict's in the fall. I grew up in South Dakota, and Julie grew up in northern Iowa. While I'm a new associate with BHS, I'm not an unfamiliar person to many of you. I've been on the BHS Board of Directors and the Finance and Strategy Committees for 2 years. As a result, I'm familiar with the mission and core values of BHS and the successes and challenges that Rocky mentioned. Being a board member also provided me the opportunity to visit a few of our communities. I've been impressed with what I've seen and the hospitality you have shown me during my visits. I'm planning to visit all of our communities in the coming months, and I look forward to meeting each of you. Thank you for all that you do to care for those that we serve each day.